Time now for this week's Health Matters. PA Lynn Szabo joining Mike and myself here in the studio today and talking about, as we kind of, just as a society, kind of hopefully close one eye and cross our fingers and move into post-COVID or endemic COVID, we're having to deal with long-term effects or I guess we're just having to deal with what comes next. And you're seeing a particular aspect of this post-COVID sort of world.
Yeah, I'm going to focus a little bit on it, but also my goal was to tell people what to expect after COVID because they're kind of surprised.
Wow, okay.
I think a lot of them thought it was, you're sick for 10 days and you're okay.
Yeah.
But not really. I'm starting to see something called dysautonomia, which is, the autonomic nervous system.
Okay.
That it takes care of the parts of the body that we don't have to think about, like breathing and digestion.
Seems important.
Okay. And what happens after COVID is some people's autopilot is like not working very well.
Ooh.
And it's kind of scary. I don't think it's super dangerous in the long run, but it's terrifying to go through. And I've seen it lately in the clinic and people totally shocked.
So like firsthand, you've seen this. Wow. Okay.
Yeah,
What's it look like?
It's usually a female patient, which, although it can happen in men, mostly happens in women. Usually it's like a really rapid heart rate and a really acute onset of shortness of breath is what I'm seeing.
Wow.
But it can also be anything that affects the autonomic nervous system. So, digestion, so people will get diarrhea, heart palpitations, blood pressure problems, breathing troubles, problems with temperature control, either flushing or feeling too cold, and problems with kidney and digestive function. So what I'm mostly seeing what looks like actually a panic attack. It's usually a middle-aged woman, maybe like mid-20s to mid-30s. And this is not the only person. This is the person that comes in to see me. Okay, so I might have a skewed idea of what it is. And I say that because it's really easy to write it off as an anxiety attack. Which is kind of disrespectful, I think. But it's unfortunately kind of a diagnosis of exclusion.
What does that mean?
That means that you have to make sure everything else is okay, and then you call it this.
Okay.
Okay. So I saw some pregnant women actually with it recently, but most people are kind of terrified. And I would say the whole point of this talk is it's not just stress, it's not anxiety.
Okay, so yeah, I mean, as somebody on the outside, I hear what you're describing, and I have specific questions about someone I know who has had COVID in relation to this. But so this is a thing, right? This isn't just a theory. This is no, this is a thing. You hook them up to the EKG. Okay, remember we go back to vitals. There's a reason they call them vitals. You get initial vitals, and a medical assistant will come running into me and saying her pulse is 145, and you're like, whoa. Yeah.
And so the way I look at pulses normal is 60 to 100. Okay. Anxiety elevation, or maybe somebody just ran in from the car or something, that could go up to about 120 or 130. But
short term, it comes down.
Yeah,
right?
Then it comes down. But anybody who's over about 130 toward 140 has something going on with them, especially if it's persistent. And then I always ask for a respiration rate, and sometimes probably because they're a little anxious, but probably more likely because of the dysautonomia, I'll see respirations about 24 to 30. Now, the problem is a high respiration. So I'll back up a little bit.
Back up even more. What's a normal respiration?
Normal respirations, I think for an adult, I would say like 12 to 20. Okay. And you can see them start to go up in somebody who's a little anxious, but also in somebody with early pneumonias and stuff. So they're worth looking at, in my opinion. But I'll see these abnormalities. They'll be persistent. They won't really go away. I'll hook somebody up to an EKG. Everything will be normal except for the rapid rate. So EKGs read things like how is your heart oriented in your body, and what's the rate, and is it regular, and if it's irregular, is it irregular for a particular reason? And you can find that kind of stuff out. And I'll see everything normal, so no evidence that they've got any kind of ischemia, which means decreased oxygen to the heart muscle. And then it's just a little bit hard to explain. And so what I've been doing is sending people to cardiology, which of course up here takes forever, but they're not in acute. They don't have anything acute, although it's distressing as an individual to have this happening in your body and not understand it.
Yeah.
So I sent people to Southern Oregon Cardiology, where they have a arrhythmia specialist or somebody that looks at the rhythm of the heart as his subspecialty, and they picked up right away.
Wow.
So once I saw the index patient, is what I'm getting to, I kind of started seeing it all over the place.
Huh.
And there isn't much to do about it except reassure the person that they're okay and that this is going to go away, and make sure you're following them closely, because I'm not writing this off to stress, but it is stressful to have something go wrong with your heart.
And it becomes like a feedback loop too when you're in it. Yeah,
exactly. And so it's really important to me that people don't get blown off and patted on the hand and sent home without a plan.
Well, it's problematic too. I mean, when people, if a healthcare person or anybody just says, "Oh, it's just anxiety," because that's a big deal, just anxiety. But this is more than just anxiety, even on top of that too.
Yeah, totally. It's more than, and if somebody's out there who thinks they might be having it, it's really easy at home to take your pulse.
Yeah.
Have somebody time your respirations. We're talking about beats per minute and breaths per minute. And then you can put on, if you've had COVID, you might have a pulse ox monitor, a little thing that goes on the finger. And that's a really easy way to see what your pulse is. And the second number in that, because it reads two numbers, is the amount of oxygen in your bloodstream. And so if it's 95 to 100, that's good.
Yeah.
If your heart rate's up because you're not breathing very well, that's below 90, then that's kind of a problem.
Okay.
So it's a nice little thing to have.
So I'm just curious, and maybe I'm going off in a completely weird direction. Is it possible or likely that this may be tied to the inflammatory aspects of COVID?
Yeah, this is an inflammatory disease.
Yeah, because it seems like so many illnesses are tied to inflammation in the body.
And I would take that a step further. I think it implies that the infection crossed the blood-brain barrier and affected the brain, the parts of the brain that we can't control. That's what that implies to me.
Wow.
Yeah.
So you couldn't get this sort of effect from like COVID had just affecting the autonomic nervous system outside the brain, just in the body. You think
like
this
if
is
it made you
brain?
dehydrated because you had a lot of diarrhea or throwing up a lot. There's a different pattern in the vitals, and that should be something that any provider could pick up easily. Yeah,
wow. Okay.
Interesting. Or the one thing we should know is that remember that the risk of blood clot goes up significantly for 3 months after somebody's had acute COVID. And one of the first vitals to be abnormal when a blood clot's happening is the pulse. So it makes it kind of obscure. So it should never be blown off to stress.
Right.
Never, because we're sending people to the ER to get CT scans and blood tests and stuff to rule out clot a lot. And we never, not at all like what we did before. It's a different pattern.
Wow. So I know someone who had, COVID back east in around Christmas of 2020.
Yeah.
And since then has dealt with what she thinks is just this kind of out of nowhere recurring anxiety, like panic attacks.
Right.
I mean, would it present like? Could this present like that?
There are neurological manifestations as well as far as psychological manifestations. But if somebody is having it's hard to tease out. So it's a little bit chicken and the egg. If somebody is having problems with the way their heart is functioning, they're going to be anxious about it.
Yeah, exactly.
Feel like a panic attack.
Right.
So that person would benefit from getting a pulse ox and keeping some numbers.
Okay.
And kind of following that person's data. And there was another person we both know on Facebook who was also talking about, I don't want to out her or anything, but it's a similar thing I think might be happening to her.
Huh.
Yeah.
Wow.
Pulse oxes are really great. You can go to Amazon. You could have 1 or 2 days if you have Prime, although ick. And
yeah, no, ick, exactly.
Yeah.
But you can have, like my folks have, they don't have a pulse ox, but they've got the cuff. They can, do the.
Well, that's a different thing.
I know. I'm just saying that it's like nowadays you can kind of have a little low
Little
key
durable medical equipment.
Yeah, exactly.
Yeah.
Exactly. Yeah.
So if somebody's out there and wondering if, how could they get one, they could also ask, I know UHS patients are given them when they get the diagnosis of COVID. If it
given
seems like
pulse
it's
ox?
prudent. Yeah.
Wow.
And then I would imagine that Dilnert Community Health Center could also set somebody up with one. They're about $20, so you could go down to Walgreens and get one.
So is the bigger context of all of this that, so much of society now is acting like, well, okay, COVID, that's over. Now we're in the endemic phase,
Yeah,
right?
right.
But isn't the bigger story of all of this is that we actually have no idea what the long-term effects of this
Yeah, we don't.
at one time novel virus is.
Yeah, I don't.
It's not so novel anymore.
It's not so novel anymore, but
It kind of, there are other viral syndromes that can cause this. Providers should be kind of aware of it, but there's not a lot of providers up here that I think are necessarily, the ER's got a lot of people that could spot this easily. But, an abnormal vital is an abnormal vital. I mean, any provider should be responding to that. But I think it would be.
I want to point out here, because there's something we haven't hit, but in your notes it says can be triggered by alcohol, dehydration, anxiety, tight clothes, and heat.
Yeah.
That's the same things that can kind of set off a panic attack.
Exactly.
Wow. Well, yeah, because that's
And tight clothes, I would think stuff around your neck, because there's baroreceptors in your carotid arteries in your neck that help control pulse.
Oh, wow.
So,
from pressure, by reading pressure? Oh, that's neat. Oh, I had no idea.
It's very cool. But, T-shirts, not ties.
Yeah.
You got more support for
that's
that.
one more good reason not to wear ties.
Right, there you go. But treatment is supportive. Okay, so it does seem in the people that I've seen, like I'm remembering the first person I saw, she's actually improved over time. So they think what happens is that the body has a cleanup period where they get rid of all these microclots and all the inflammatory stuff. And then it does kind of resolve.
It kind of settles back to base.
And then there is also some data actually recently. I'm not really prepared to talk about the preprint on it, but I saw it yesterday in something I was reading where vaccination actually can help. So people that get vaccinated post-COVID actually, and if they kind of have these symptoms or long COVID diagnosis, they actually improve about a third of them.
I need to talk to my person, because things sort of settled down for her, and I think it might have been in relation to the time of a booster.
You mean she got better about shortly after she got the booster?
After the booster, the panic attacks didn't seem to be as much, or I didn't hear about them as much.
Right.
So yeah.
There's also post-traumatic stuff. I don't think the person you're talking about was hospitalized, right?
No.
She was treated as an outpatient. But people who were hospitalized and also people on vents have significant post-traumatic stress disorder issues.
Makes sense.
Yeah, it's kind of terrifying. So there's not really care available here. I mentioned Southern Oregon Cardiology had somebody who was I thought was really helpful, but there are special clinics for this. So at UCSF, there's something called the Optimal Clinic. They are evidence-based, multiple specialties. So they draw together multiple, like cardiologists and pulmonologists and immunologists. And right now they're treating mostly based on symptoms, but they also are collecting people for research. So that's good. And I'll go ahead and throw the number out there in case anybody's interested, but you could also Google Optimal Clinic at UCSF. But they're 415-353-2961. And then the next closest thing is at Stanford, which is their post-acute COVID-19 clinic. Similar structure, so data-driven, even more research opportunities. Stanford is always really exciting for the research.
Private school.
So their number is 650-736-5200. So that's kind of exciting. I know that because that's what my mom does. That's her retirement job, is to be a lab rat, I guess.
Oh, really?
Yeah. Yeah. So that's kind of
That's
cool.
something to do.
Yeah.
There's a plan. Wow.
I'm thinking maybe
She got a free iPhone out of it. They were
cool.
seeing how you train elders to use technology, and she got an iPhone
Right.
and an iWatch. She's more technologically savvy with an iWatch than I am.
That's crazy.
Yeah.
Oh my God, that's wonderful.
It is cool.
That seems like, they should just offer that everywhere for people. I'd do that.
Yeah.
I don't even want the iPhone, but
Right.
Well, Lynn, thank you very much. This brings up a lot of issues. The person. Okay, I'll just say it because she won't hear it. It's my daughter, my eldest back east, who had COVID in December, and then had anxiety issues after, and therapy.
So you mean
all.
December 2020?
2020, yes. Sorry,
So it's been a minute. Yeah. since
yeah,
you've been
yeah,
sick.
but it's been all since then. It became a deal, but there were other things. Young person living in the city, and there were lots of stresses as well that might have triggered this. But yeah, I think it was a thing, and much more of a thing after her bout of COVID, and it seems to have settled down subsequently.
And she just isolated at home.
Yeah.
She wasn't really sick, as I recall.
Yeah, not really bad. No.
Yeah.
No,
She never had the breathing issues. Yeah. Yeah. They're finding that even mild to moderate symptoms. It makes me wonder about the babies, because I actually see a lot of neonates or newborns with it.
Really?
Yeah. And, babies like a year plus or minus. I wonder a lot of things about those kids.
Like what? Just long term, having experienced this.
Yeah, well, what their development is when their drive is to connect with faces, and faces have masks.
Oh, I see what you're saying.
Yeah, I think there's a
okay.
study in that, but we'll see.
Wow,
Longitudinal.
So I have a question, which is a bit of a different direction, but like I was noticing, as dismal as Del Norte County's vaccination rate remains, it is seeming to creep up quicker than it was for a while.
Has it? I haven't been. As far as I know, we've been pegged at 55.
But we're like, I think almost like 56 maybe now, which is still dismal, but for what was happening here. And I guess what I was wondering, Lynn, is because it certainly, like you were saying, like people who get COVID and then they get a vaccination kind of helps with these types of things. Do you think as we move away from so much of the intense politicization of this, that people are starting to just think of getting vaccinated as, well, yeah, that's what we do.
And I think as people, number one, see it's a real disease, because there's certainly people in the Native community who, there were a lot of people who died. So there's a lot of grief around that. And I think a lot of learning. And then also people who got COVID twice, who got Delta or got the original strain Alpha and then went on to get either Delta or Delta and Omicron. And I don't think I've seen anybody that had it 3 times yet, but I don't think it's impossible. So I think there's a realization that it's not really going away. Plus, I think people who are vaccine resistant, I think there's the adamant never going to happen, and then there's this gray zone, like it's not going to happen to me now. I'm not going to get vaccinated now, and they're starting to approach me with questions.
Really?
And it's huge, because I think that signals an opportunity to get some data-driven information out to people, but I think they're kind of looking that vaccination might really be part of how they want their life to be, because they want to go traveling. Maybe they have to get vaccinated. Because they want to go to concerts. Maybe they have to get vaccinated.
Okay.
And so they're not like absolutely closing the door. And it's kind of cool in the exam room, where there's no witnesses, the questions that people will ask.
Can you give us an example? Like, are there specific sorts of questions that you get from folks like this who have been resistant to vaccines?
Yeah, it's confusion about what messenger RNA is and how that's different from DNA, and how messenger RNA is kind of impermanent. It's kind of like an email.
So they're not asking new questions.
it.
They're just finally getting around to asking the questions that everybody answered a year and a half
what
ago.
I'm finding out too is that they're also asking questions of multiple people.
Okay.
But they're being selective in who they ask the questions of.
Sure.
And even the people that I can kind of open a conversation even with a never going to get vaccinated person, If I say something as simple as, well, let's get a vitamin D level on you, then make sure your vitamin D is good, because people with low vitamin D levels really don't do very well with this disease. And maybe this is another way to kind of inch up your protection. Not as effective, but I'm willing to look at other workarounds, and then that's like, boom, okay, so you're not just Johnny one note.
Gotcha. Yeah.
And so that I find really opens conversations.
Wow.
I was kind of wondering and maybe hoping if like what you were really getting to was prominent vocal anti-vaxxers once they're in the room where there's no witnesses going, yo, can you hook me up?
Yeah, don't tell anybody.
Yeah, sometimes they come in the back door.
They come in the back, yeah. Wow, well, that's really interesting, and I'm going to pass this on to my daughter and see
if we're talking about her, I think you also mentioned she had tinnitus, right? She had ringing in her ears. That was persistent.
Yeah.
I think that could be also part of it.
Yeah. No, I think, and I think she was thinking that as well, and thinking this is just, the long, and she's worried about long COVID and things. But
if I was parenting this young adult, I would send her a pulse ox if she didn't already have one.
There you go. There's a okay.
Because, she's a data nerd.
Supplement. Oh, yeah. She'd be walking around getting everybody's pulse ox.
I know, it's kind of cool.
Do you have to get like some super stylish one for New York City?
Yeah, maybe something like
You could
branded.
You could bedazzle it or something.
No, she doesn't need
Just
that.
don't wear fingernail polish because you'll get bad data.
Right.
Oh, that makes sense.
You'll scare yourself. So.
Oh yes, because of the
it reads the oxygen
off-gassing of the fingernail polish. Right.
Yeah, you're going to make the nail more opaque than the reader wants.
Because it's an optical thing, right? It's like reading through the nail.
Oh, okay.
You're
I had no
coloring
idea
the
how it
nail.
worked.
Yeah, I don't think you could use them. There's special ones for babies that do toes and earlobes.
Oh, right. I've seen the earlobe
but
one.
that wouldn't be suitable for an adult.
Yeah.
Like if one of these people who wears like the black fingernail polish, it would
You're
just say
dead.
you're dead.
I know. That's when the medical system forgets it's the nail polish and runs to get maybe because they're oxygen.
Oh my God, they're dead.
They're like 12, No, it's just a fingernail polish.
Well, Lynn, thank you very much. Lynn Szabo, PA. Is there anything else we should know this week?
No, but I'm looking forward to maybe getting Dr. Parker on.
Is that the person I'm supposed to call?
Yeah.
Yeah, okay. I will call this week. I have a whole day of calls tomorrow. That's my
Good.
day, so
That's
I'll try to set that up.
That's good.
Do you want to be a part of that? I know we talked about that
We
before.
can talk about it, whatever works for you guys.
Okay.
I'd like it to be her voice.
Sure. But I'd also
awesome.
I'd appreciate your insight to know what sort of questions to bring it out, and she's probably pretty good at supplying that. But yeah, just getting into pediatrics and pediatric care in Del Norte, I think that's an important thing to discuss.
Yeah.
Okay.
Yeah. I think her focus is immunizations in general.
Right. Okay.
But I'm sure that covers COVID too.
Yeah. All right. Well, I will do what I have to do, and what I've said I will do. Okay. Thank you. Lynn Szabo, PA. Health Matters. We'll do this again next week.
Okay.